The traditional methods of assessing gut health leave a lot to be desired. We all know that there are a lot of people that have got obvious symptoms. They are struggling with their guts, and they go and have traditional tests like colonoscopy and gastroscopy. There is a place for those tests, but what happens is that by the time something is picked up on colonoscopy or gastroscopy, that means that that problem has been there for a very long time, because what we're looking for when we do these tests, we're looking for anatomical changes. So we're physically looking to see if something doesn't look right. But we know that what changes first is the physiology. This is the way things are working, and with those tests you cannot look at the physiology. So the best test to do if you want to assess your gut health comprehensively is something called a GI map. So this is a functional medicine stool test where the patient provides a stool sample that gets analyzed with a PCR method. This is the same way that COVID testing is done. So why this test? This test is basically one test, but it shows you a lot of things. So you can say that this is like 6 tests in one. This test is going to show us your digestive function. It shows us if you are digesting your fats very well. It shows us if you've got enough pancreatic enzymes. It also shows us your immune system, because 80% of the immune system is resident in the gut. The immune system in the gut called secretory IgA. We check and see. So, we can already make an assumption about your immune system just by testing, because we look at 80% of the immune system there. It tells us if there is inflammation and tells us how high is the inflammation. It also shows us if this person has got the ability to detoxify toxins. We check for an enzyme that the body uses to detoxify toxins. And also the other thing that it does, it shows us it's mapping your microbiome. Shows us if you've got any opportunistic bacteria, so bacteria that have overgrown. It shows us if you've got enough of the keystone species. So we do know that as far as the gut bacteria are concerned, there are some that we call keystone species, and if you're missing these, and if the ratio is not right, then that person will have a lot of symptoms. We check for H. pylori, which is a very common infection. It will show if there is viral infection. It will show if there is yeast infection. It will show if there is any bacteria that connected with autoimmunity. And as you know, autoimmune diseases are on the rise. So this is a comprehensive test that that is very accurate, that is very upstream, because it checks things before they get really bad. It also checks if there is anything like blood in the stool. So this is blood that you cannot see with the naked eye. When you see blood in the stool, usually maybe it's you've got a hemorrhoid and you can see the blood. But when we're looking at blood that's coming from high up, that has already been digested, you can't see it with your naked eye. So this test will show us if there's blood in your stool, and if there's blood in your stool, that shows you that there is something quite grave that's happening. So this is a test that we offer to our clients, and it's a test that is quite accessible, because it's easy. It's just providing a stool sample in the comfort of your own home, and 2 weeks later you get the results. So we encourage you to explore this fantastic test.